Hello there, are you okay? Thanks for joining me. My name is Dr. Rajiv. This is my education channel, YouTube Surgery and Orthopedic Education. In this lesson, I shall cover 10 important MCQs on the topic Basic Surgical Anatomy and Physiology for the preparation of INI-CET, NEET PG, INI-SS, FMGE and UPSC Combined Medical Services examinations. Each MCQ will be followed by a detailed description. You may prepare a note of important points for future reference. A lot of important stuff will be delivered in this talk, so hang on till the end. Thank you. The correct answer in question number 1 is option D. The recall of relations and boundaries of the orbit gives the clue to the answer. Above, there is anterior cranial fossa and frontal ear sinus. Below the floor, there is maxillary ear sinus, medially ethmoidal ear sinuses, and temporally the temporal fossa. Now it is apparent that any trauma to the floor of the orbit will lead to accumulation of blood in the ipsilateral maxillary ear sinus. The inferior nasal concha or inferior turbinate is a bone, not a cavity. It extends along the lateral wall of the nasal cavity and they are not related to orbits. The correct answer in question number 2 is option C. Orbital fractures can occur in isolation or as part of multiple fractures. Orbital fractures can involve the orbital floor, medial or lateral walls, and the roof of the orbit. In the orbit, the bones of the roof and the lateral walls are strong, while the bone forming the medial wall is thinnest, but it is supported by the bone separating the ethmoidal air cells. On the other hand, thin bones of the floor of the orbit and the roof of the maxillary sinus has no support, and therefore it is the wall that may break with relative ease in an event of trauma. The correct answer in question number 3 is option D. The breast is located in the superficial fascia of the pectoral region. Vertically, it extends from second rib to sixth rib and horizontally from lateral border of the sternum to the mid-axillary line. Hence, it will be wrong to say that most of the breast tissue lies in the upper inner quadrant of the breast. The breast parenchyma consists of about 15 to 20 lobes, not just 10. The connective tissue condenses to form fibrous strands or septa. They connect the dermis of the overlying skin to the ducts of the breast and pectoral fascia. They form hollow conical projections of fibrous tissue filled with breast tissue called suspensory ligaments of Cooper. They are arranged in a radial fashion throughout the breast. The axillary tail of suspense is an extension of breast tissue directed supralaterally from the primary breast into the axilla through the foramen of Langer. The tail of the breast is important to the fields of general surgery, oncology, plastic surgery, and anatomy. A well-developed axillary tail may sometimes be mistaken for a mass or enlarged lymph nodes or a lipoma. It may be a site of breast cancer. A breast cancer may develop in axillary tail even though it might not seem to be located within the actual breast. The correct answer in question number 4 is option B. Main hormones responsible for breast development and function are estrogen, progesterone, prolactin, and oxytocin. During pregnancy, levels of estrogens, progesterone, and prolactin increase steadily until term. Estrogens are primarily responsible for ductal proliferation and progesterone for lobular development in the breast. Prolactin is crucial for milk production or lactogenesis. Its levels rise during pregnancy and peak after childbirth. After childbirth, oxytocin is involved in the milk ejection or let-down reflex. It causes contraction of the myoepithelial cells lining the duct walls, forcing milk into the ducts from the alveolar lumens and out through the nipple. The gonadotropins, luteinizing hormone, and follicle-stimulating hormone regulate the release of estrogen and progesterone from the ovaries. These do not act on the breast. The correct answer in question number 5 is option B. The cystic artery most commonly arises from the right hepatic artery behind the common hepatic duct, but its origin can be highly variable. In 15% of cases, the cystic artery may cross in front of the common hepatic and cystic duct. Sometimes an accessory cystic artery arises from the gastroduodenal artery. The cystic artery lies within the calot's triangle, which is an anatomical space bound superiorly by the inferior surface of liver, laterally by the cystic duct and the medial border of the gallbladder, and medially by the common hepatic duct. Calot's triangle or the hepatobiliary triangle is a surgical landmark used to locate and ligate the cystic artery during cholecystectomy to avoid injury to the extrahepatic biliary system. The correct answer in question number 6 is option A. Most of the venous blood from liver is drained by three major hepatic veins: left hepatic vein, middle hepatic vein, and right hepatic vein. These drain directly into the inferior vena cava. The middle hepatic vein divides the liver into right and left lobes. The course of the hepatic veins divide the four sectors of the liver into 8 segments. Each of these segments act as a functional unit of liver, and each has its own branch of hepatic artery, portal vein, and bile duct. Also, each segment is drained by a branch of the hepatic vein. The correct answer in question number 7 is option A. The vitellointestinal duct or omphallomesenteric duct is an embryonic structure that connects the yolk sac to the midgut during the fetal development. Normally, it obliterates between 5 to 10 weeks of gestation. Interruption to this process results in persistence of this duct causing a variety of abnormalities such as Meckel's diverticulum, vitelline cyst, persistent fibrous cord, and umbilicus sinus. Patent urachus causes a spectrum of umbilical disorders that result from persistence of communication between the developing bladder and the umbilical cord. It can be evident at birth or later. The presence of a urine leak from the umbilicus present at birth or commencing soon after suggests this diagnosis. In later life, the urachus becomes patent due to increased pressure in the bladder from some kind of bladder outlet obstruction, such as prostatic hypertrophy, resulting in drainage of urine at the umbilicus, causing local dermatitis and recurrent urinary tract infections. The Wolffian ducts or mesonephric ducts are paired embryonic structures that form the male internal genitalia. In males, each mesonephric duct becomes differentiated into four structures: the epididymis, vas deferens, ejaculatory duct, and seminal vesicle. In females, the mesonephric ducts disappear. The Mullerian or paramesonephric duct form the fallopian tubes, uterus, cervix, and proximal third of the vagina in females. The correct answer in question number 8 is option B. The mucus diverticulum is a remnant of vitalointestinal duct. It is present in about 2% of the population, is 2 inches long, located at 2 feet from the ileocecal valve, and in 20% cases contains heterotropic epithelium of gastric, colonic or pancreatic type. If gastric mucosa is present in it, peptic ulceration can occur and the patient may present with painless dark rectal bleeding or melena. If the stomach, duodenum and colon are excluded as a source of bleeding by endoscopy, technetium-99 scanning may demonstrate mucus diverticulum as the source of bleeding. The correct answer in question number 9 is option D. The esophagus is a 25 cm long muscular tube. It begins at the lower border of cricoid cartilage, opposite the lower border of C6 vertebra. It is lined throughout its course with a stratified non-keratinized squamous epithelium. The venous drainage is through inferior thyroid, azygous, hemiazygous, intercostal, bronchial, left gastric and short gastric veins. But the azygous and hemiazygous venous systems drain most of the blood from esophagus. The pharyngoesophageal junction is the narrowest part of the digestive tract after vermiform appendix. The correct answer in question number 10 is option B. The oral cavity is divided into a number of parts for the purpose of cancer staging. These are lip mucosa, buccal mucosa, upper alveolar ridge, lower alveolar ridge, retromolar trigone, floor of the mouth, anterior 2/3 of the tongue, and hard palate. Hence, tumors of only these parts are labeled as oral cavity tumors. The posterior third of the tongue and soft palate are parts of the oropharynx, not that of oral cavity.